welcome back to 5 on Fridays, the show recorded on a Thursday, which doesn't cover 5 things or go out in 5 minutes. The name makes no sense, and I'm open to suggestions. But whatever, we're all stuck inside, and it's nice to spend a couple of minutes together each week. I'm working on a very big video on housing co-ops, which should be out next week, but in the meantime, I thought I'd give you guys some hot takes. Hot takes. Hot takes! Last week I was pointing out the discrepancy between provinces, where despite having a minor outbreak compared to other provinces, Quebec had the strongest measures. Meanwhile, in BC and Alberta, they had higher cases per capita, but weak measures. And it didn't really make sense. Well, now we know why. We had a severe outbreak in Quebec. It was just being underreported because we had a legacy, not at all appropriate for outbreak, policy. When I first saw the spike, I thought that the situation that was going on was similar to the spike that you saw in China in February, where due to the testing facilities being really overwhelmed, they decided to go with the clinical diagnosis rather than with the confirmed test result. A clinical diagnosis is when a clinician, or medical person in dumb words, diagnoses the patient without having like lab blood work done. Kind of like if a kid falls off a skateboard and, you know, if their arm's bent, probably a broken bone, don't really need the x-ray to confirm that. But that's not what happened in Quebec this week. What we had in Quebec was a process where laboratories and hospitals had to confirm their results with the Laboratoire de Santé Publique du Québec for it to count. I looked into other provinces trying to answer the question, are they doing the same thing as Quebec? Like, are we going to get a spike there? But it was really, really hard to figure out. For now, I am highly suspicious of the numbers across Canada. But in Quebec, though, basically we had one lab trying to process all of our test results. And we were doing so well. Remember last week where our government seemed to be so proactive, and then this week we find out they're actually being reactive and that they've been screwing up government transparency too. This is my neighbor. He has one MP3 CD, and it starts off, you know, "What is love? Baby, don't hurt me, don't hurt me, no more." We should be hearing Johnny Cash fairly soon. You know, I never liked the song and I always thought it was stupid, but since moving into this place, it's kind of grown on me. When you look at BC or Alberta, you can see at a glance how many tests they've done and how many of them have come up positive. BC has a really handy report every single day, except Sunday when they seem to take the day off. Yeah, they do that. Can someone please approve the overtime for your workers in BC? Even better is Ontario. They update every case, the age, the action taken, if they recovered, and when the infection was presumed to have taken place. And they do this 2 times a day. Meanwhile, in Quebec, where the fuck is this information? It gets mentioned in press conferences, but even the basic headline number of tests, which they usually mention during the press conference, isn't put on a website. And if this whole time they'd been transparent and told us confirmed cases, the hospital lab diagnosed cases, and the cases under investigation, more people would have taken this seriously. Instead, what happened is last week it sounded like they were overreacting, and then this week it's like they're underreacting, and I'm wondering why they still have taxis and restaurants operating. Thinking about China, I actually think that Quebec should just go with the clinical diagnosis. Who gives a shit? Don't try to save face. Politicians, at the end of this whole thing, once the dust is settled, you're only going to be judged by the body count. Don't worry about these short-term results and how they make the province look. If a person has a fever or a cough, they have COVID-19. Go home and rest. If a person has a fever and a cough these days, when would you say anything other than that? Fever and a cough, you say? Well, here's your frisbee. Get out there, you rascal. When a clinic for testing opened the other day, 2,000 people were tested and like 1,500 people were turned away. So right now, the message is stay home and do your part. Don't leave. Unless you want to mix hundreds of infected and healthy people together. I have to say, I think they're living in denial about it being airborne. Washing your hands is great, but you can't safely enter a room with someone who has the virus for hours afterwards. There are probably people who went into that clinic without the virus and walked away with it. So why is the government doing this? Are they crazy? Well, a fair amount of it is to placate people. Those people standing in line are scared and concerned. They're Canadians trying to do the right thing. The government has basically been using fear tactics and social shaming to get us to do what's best. And although the ends justify the means, these are the consequences of taking that approach. So the government can't save us, but I will. You're trying to do the right thing, and the right thing is stay home and drink Gatorade until you're struggling to breathe. It's a fucking virus, and the only thing that they can do is put a respirator on you if you can't breathe. That's it. The government doesn't need your extra confirmed case to convince people of anything. We're already in a, oh shit, this is real situation. So just keep the hospital and clinics reserved to those who actually need them to stay alive. You should stay at home. Thank you, Mr. Robot. I'm lonely and will not. Now that the stupid Olympics, where nations see who can throw a stick the furthest, have been postponed, the real Olympics, where we see how a nation handles a health and economic crisis, is well underway. Let's have a look at the North American division, where we compare provinces and state. Of course, we're now using the only metric that we can agree on across the continent, whether someone is dead. Although this sounds like a crass joke, let me tell you guys, the real joke here is our inconsistent metrics. In number 1, New York State. Number 2, Louisiana. Number 3, Washington. But in the COVID Olympics, the real winner is Nunavut, with no dead and no cases. What I'm concerned about is that generally it's very hard to handle this crisis. Places that have not experienced severe outbreaks simply don't have that much global trade. Formidable, competent governments like Switzerland and Germany and Norway have still struggled to handle this crisis. It's making me quite uneasy. Are we really that special? Do you think we're better than Switzerland? Do you think we're better than Norway? Those countries have only managed to plateau the growth, and they have all the money in the world, high public trust, and pretty wise government. When we look at the countries that successfully reduced the outbreaks, there are two general approaches. One is the authoritarian approach of China, where you go really hard on self-isolation and you force it to happen. The other is the kind of CSI approach of Korea and Taiwan. Community cases are hunted down by backtracking people's paths, lots of testing and rooting out cases. In Taiwan, they force self-isolation by tracking people's phone locations. If your phone is turned off for more than 15 minutes, someone shows up at your house and makes sure you're there. For most Western countries, they're trying to walk the line between taking things that don't go against our values and which are easier to swallow. Many of the approaches that are being used overseas would not be legal here or would freak people out, but we have different advantages as a free and prosperous society that mean we aren't going to beat this thing the same way as Taiwan and definitely not China.
Don't trust China! China is asshole!
This is part of what makes Quebec's behavior this week so annoying. I mean, I'm glad that they fixed this, but we have been screwing up on one key advantage: transparency. Hopefully after all this is over, Canada can unify its measures for pandemics. It would be great to standardize things so that we understand where we are at, relatively speaking. Province to province, it's hard to compare things when we don't even have a standard definition of a confirmed case, and we have different transparency standards. It would be helpful if we could have a standard level of outbreaks across the country as well. So Category 1 outbreak, these things are closed. Category 2 outbreak, these things are closed. Level 10 outbreak, it's martial law, you know, whatever. We might also consider sharing healthcare data and allowing the monitoring of citizens during an outbreak, so we have something like the Taiwanese option. All these laws that are passed during this time need to have total sunsets written into them and be completely rewritten after everything is over. The worst legacies of so many crises like this are not actually the dead, but the permanent damage done to the legal frameworks of their societies. I would rather see 2% of the population die than see Canada left with a permanent law passed under duress. The Espionage Act in the United States was a law passed to prohibit interference with military operations during World War I. It's now used to go after Edward Snowden, who was a guy exposing the overreach of another law passed during a crisis, the Patriot Act. The similar and often abused War Measures Act in Canada took 74 years to repeal. We're still stuck with the consequences of our own 2001 Anti-Terrorism Act, and that wasn't even our own country's crisis. Unless you count having to house Americans. Panicking people don't think through these consequences very well, and it's understandable, we're all human. But motherfuckers in some decades to come will. So let's save the country, but ensure we come out of it with a country worth saving. I mean, have you seen America recently?
What do you say the Americans were scared though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say.
I
think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism, and the same with NBC and Comcast. I don't call it Comcast, I call it Comcast.